Here we go. We're just going to double check and make sure everything sounds good, and then we will get moving. So let's see here. Let's take a look and see how we sound. Let's just double check and make sure everything sounds okay. Almost there. Almost. Okay. I think that's good. I'm pretty sure. Just one more sec. Sorry about this. Yep, I think we're good. I think that's good. I think we're good here. So I'm just going to share this on Twitter, and then we'll get going. Okay. So thank you for your patience. Almost there. Okay. Okay. All right, here we go. Episode 57 is just about to pop. Here we go. Here we go. Okay. All right, we are all posted on ye old Twitter, so that means it's time to get going. So here we go. It looks like Jonathan Cogburn's here. Hello, Jonathan. Glad you're here. Welcome, welcome. Glad we're all here. Let's get this show on the road. So good afternoon, everyone. Good evening, good morning, whoever you are, wherever you are. This is Dr. Patrick Lockwood, but for the purpose of this podcast, I'm just Patrick. And welcome to yet another episode, thrilling episode of UnShrink Me. And if you are brand new to the podcast, just know that UnShrink Me is a weekly podcast hosted on YouTube with my co-host there, Willow. And the focus of the podcast is just two things and two things only. Number one, provide open and honest criticism of ideas in mental health, psychology, psychotherapy, psychiatry, etc. So that number two, everyone who is seeking out services, patients, their families, their loved ones, their spouses, can have a better understanding of what mental health services are actually good for, not to be fooled by scams or fraud or things like that, so that they can get the most out of their mental health services. So the only goal, really, truly, genuinely, the only goal of this podcast is just to provide a critical voice that will allow everyone who is taking advantage of some kind of mental health services to get the most out of those services. That's my only goal. And I hope that it's perfectly clear why I'm here and what I'm here to do. And I'm very, very grateful that I have friends who get to come out and chat with me and joke around with me. I'm very grateful that people come into the chat and hang out. And so thank you all for being here. If you are brand new to this, just know that this is just for fun and just in case it's useful for you. And also, if you're brand new to this, just know that every podcast is not, N-O-T, not sponsored by Celsius. However, I do love this stuff and sometimes makes for interesting entertainment. So without further delay, we have some fun to talk about today. So first up today, we're going to be talking a little bit about, knowing things versus doing things in therapy. That's an interesting conversation that's really, I think, worth it because there's a lot of mistaken beliefs, I think, about quote-unquote good therapy. So that's one of the things we'll be talking about today. We're also going to be talking about Dr. James Davies because why not, obviously. Personalities. We're going to talk about, what else are we going to talk about today? We're also going to talk about diagnosis. We're going to talk just a smidgen about kids, because why not talk about kids, all things considered. So yeah, let's start there and just kind of see what happens. So first and foremost, let's start with a softball, because I think it's always more fun when we start with something nice and easy for everyone to walk through together. And so my first discussion for today always comes from somebody I follow, and I think this is where it might get a little contentious, or maybe it won't. I don't know. But we're going to talk about Dr. James Davies to get this podcast ripping and going. So not too long ago, just very recently, I think one day ago, he put out a post that I think is worth us discussing. So I'm going to retweet it real quick, and then we're going to get going. And for those of you who are brand new to the podcast, just know that I always retweet things I find on Twitter. And if you don't know where to find me, my handle is at Alobha Patrick, at ALOBHAPATRICK. Alobha Patrick. Here we go. Okay. So one day ago, Dr. James Davies, at JDAVIES PhD. Here's what he said. He said, "My profession continues to feel no guilt and shame, labeling people's personalities as pathological and their reactions dysfunctional. It even believes, the profession believes, that the move is medically justified. Let's be clear, it's not. There's no biological evidence to condone these stigmatizing ascriptions." So let's start with talking about personality, because I think this is a very important topic, and I think a lot of people in therapy or in treatment or rehab or whatever need to understand this. So there are 3 levels of personality that we should all be aware of and understand. There are personality traits, there are personality styles, and there are personality disorders. I have this suspicion, but I could be wrong, because maybe he doesn't know anything about the research on personality, but I have this suspicion that Dr. James Davies would probably say there is such a real thing as personality traits. And logically speaking, if you believe there are personality traits, these real things that do persist across time and circumstances, then probably you would be willing to believe there are at least personality styles, because if you clump these personality traits together in an organized way, aka personality organization, you might have a personality style. Now, style is not a rigid thing. It doesn't mean you're forever permanently one type of way across all circumstances. Because if you have different personality traits, they might show up differently in different contexts. Trait extroversion, trait openness, conscientiousness, agreeableness, neuroticism, as in the Big 5 personality. So, I would imagine that Dr. Davies would be willing to grant the first 2 premises, that you can have a personality trait, there is such a real thing, and number 2, there's a personality style. And if Dr. Davies, you're listening to this, there is actually a lot of research on the Big 5 personality and what it looks like in the brain. We actually have some research on trait extroversion, trait neuroticism, and trait openness in the brain, for instance. So, there is a lot of research on personality traits and what they look like, both nomothetically and ideographically. That being said, personality disorder is the next step of this. So what does it mean to have a so-called personality disorder? It means that these traits are on the extreme end of the spectrum. If you think of like percentiles, like there's the 50th percentile, which is average. There's the 90th percentile, which means that you're more that trait than 90% of people on the planet. And there's the 10th percentile, which means that 90% of the planet is more that trait than you are. And so percentiles are a great way to think, but a lot of people are statistically illiterate. So let's be clear. Personality traits, even at the extreme ends of the spectrum, are not inherently pathological. The real question is, when it comes to personality disorders, is there a coherent pattern of behavior? Coherent meaning a reliable way of functioning across time and space. Is there a pattern of traits that work together to cause distress and impairment? That's all that means. And if you look at certain disorders in the DSM, some of them are very reliable and do cause impairment. At the extreme end of the spectrum, like NPD, narcissistic personality disorder, causes all sorts of distress and impairment across cultures. Whereas others are not super solid constructs, right? So most of the cluster C personality disorders, like avoidant and dependent, etc., are not really good constructs, scientifically speaking. But the idea that there is no personality style is silly. All of us have a personality style. So if you take the Big 5, openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism, it is 100% the case that all of us fall along the continuum of these traits. Some of us are more extroverted than others. Some of us are more introverted than others. Some of us are more neurotic than others, and so on and so forth. And these traits, when you map them out, where you score, percentile score in each of these columns, these 5 columns, will tell you your personality style. Now, that may or may not be super impairing depending upon what kind of life you live, what niche you live in. Because one way to think about it is all personality traits are niche specific. So, for instance, people who are narcissistically organized probably do great in environments and situations, aka niches, where being egotistical and performative and excessive are useful, like being an actor or musician. Hello, mathematician. Glad to have you here. So, what I would say, dear Dr. Davies, is do you actually know any of the research on narcissistic personality disorder? Have you checked out Keith Campbell? Have you checked out the research on BPD? Have you checked out the research on, the Big Five model of personality? Because there's a lot of there, whether or not there's a specific brain correlate. And the idea, by the way, this is a sleight of hand that he does, and many people do, by the way. The idea that these traits have to specifically, perfectly correlate to a brain area is absolute horseshit. Just because there's no perfect brain area doesn't mean specifically that it's not real. Like there is no PTSD in the brain. However, there are some reliable brain patterns that relate to PTSD, that relate to intrusive memories, that relate to hypervigilance. So there doesn't have to be perfect brain areas for them to be real problems, right? If you've ever met someone who's truly struggling with borderline personality disorder, their life is miserable, not because they are bad people, but because their patterned ways of reacting to the world keep them self-sabotaging. Not because society should be more accepting of splitting, for instance. We should not be accepting of splitting and catastrophizing and chaotic interpersonal behavior. Not whatsoever. So, dear Dr. Davies, thanks for playing. I just don't think you actually fully understand the research. If you ever want to talk about it and dig into the nitty-gritty, we can remove your straw man, this fake idea that there has to be perfect brain correlates for it to be a real problem. So, and if you want to talk about another philosophical way to approach it, there are tons of things that don't have a there, like gravity, that we have a theoretical idea about that have practical consequences. So gravity has practical consequences, and we all believe in it, even though we can't prove that it exists from the point of view of physics. So anyways, I hope that was understandable to everybody. All right, I want to dig into something a little more spicy. So, it looks like we have one of our good Twitter friends here. He said, biological markers have been so helpful in my career. Crazy that clinicians have not noticed that these patterns over long periods of working with people. Yeah, I mean, biological markers are great, but that doesn't mean that they're the be-all, end-all of anything. Because the biological markers don't even mean anything useful in many situations, right? So I would say that it's cool to have them, to know them, to pay attention to them. It's also not the most important thing, which is, I think, a nice segue to this tweet I want to talk about right now. So, there's this really interesting post that was put out 4 days ago that I responded to that I want to retweet right now because I think it'll be useful for a lot of people who are currently in therapy, whose loved ones might need therapy, etc., etc. So I'm going to retweet my own post from 2 days ago right now. Okay. So, a few days ago, this person who I've never talked to in my life, so I don't know this person, I believe. His name is Joshua Boulter, I think. And his handle is at ATX_therapist. 4 days ago, here's what he said. He said, in therapy, as in all of life, we are smack dab in the middle of a mystery. Unknowing is the proper stance. So just to say that one more time so everyone can hear it, he said, in therapy, as in all of life, we are smack dab in the middle of a mystery. Unknowing is the proper stance. So what he's saying, I believe, if I'm interpreting fairly, and you can certainly call me out if I'm extending or exaggerating or something, he said that, therapy is a mystery, life is a mystery. Nobody fully, truly, really knows what's going on in any of these situations. And so because of that, we should have this attitude of not knowing when we sit across from people in therapy. Okay, so here's what I said 2 days ago when I found his tweet. Here's what I said. I said, knowing is mostly useless in therapy. Tolerating, accepting, sitting with are more important than knowing. Knowing is for therapists to intellectualize to defend against their own feelings and drives. Knowing is for unrecognized narcissistic needs. So just to take his tweet separately from what I said, I can completely concur with the idea that therapy is a mystery. Therapy, having a relationship with someone, professional or personal, it's arrogant, to say the least, to believe that you fully understand yourself in that relationship with someone else, let alone fully understand the other person. But layer number 2 to this is how accurately you understand yourself or the other person. So there's fully, like having enough knowledge to make a judgment, but number 2, making a correct judgment or a realistic judgment despite what you know. So I think it's extreme hubris, extreme anxiety, or not anxiety, extreme arrogance and narcissism to believe that you can both fully and realistically, reliably, accurately know somebody else in relationships, especially in therapy, which is probably going to be music to Nick Tabor's ears. So what I mean by this is good clinicians or clinicians who have ethics and principles will realize that the relationship they're having with their patients is fungible, it's changeable, it's malleable. There are new pieces of information you learn over time. And in some cases, you couldn't have known that information at the beginning of the therapeutic relationship because sometimes it takes people a while to open up, etc., etc. And so for various reasonable and logistical circumstances, it's impossible to truly, fully know somebody else and reliably, accurately know somebody else. Because to fully know somebody else means they're going to be perfectly transparent with you and tell you everything you need to know, which people don't do in therapy. People lie to you, number 1. Number 2, people withhold from you all the time in therapy, and that is normal. So if you are a patient and you feel the need to either lie to your therapist and or withhold from your therapist, that is perfectly normal and understandable. I do not believe you should do that, but I'm not here to tell you what to do. I just think it is counterproductive to lie to your therapist or withhold from your therapist. That being said, it is perfectly normal to not only withhold things from your therapist, it's also perfectly normal to lie to your therapist. I don't encourage it, I just want to normalize it. That being said, all of that already having been said, there's this really weird fetish that some therapists have. And dear, if you're out there, dear patients, dear family members of patients, I don't understand this myself as a professional or as a professor, which is funny, so just bear with me. It's going to seem ironic once I say what I'm about to say. I cannot imagine, personally, why you give so much attention and energy to knowing things about the patient. I just don't get it. Because quote unquote, knowing yourself and all these very simple quotes, all these stoic wisdom quotes, know thyself and blah, 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 blah. All of that's totally fine and valid and whatever. I also just don't understand why people care so much. Because most of the time, knowing particular things isn't actually going to make you feel better or have you more motivated towards healthy goals. Our buddy here says, lying is normal and expected, especially at the start. Why the hell should they trust me? Exactly. Have fun with your soccer game, man. So I really find myself stuck on this idea that it's even useful to know things sometimes. For instance, let's go back to Dr. Davies' point. Let's just say that someone actually has a diagnosis that's valid and real. of borderline personality disorder, does knowing that label actually make your life better? Maybe in some cases it does. But is really what helps in DBT for borderline or transference focused therapy for borderline, is it knowing things that actually makes your life better? I don't sincerely believe that. I believe knowing things doesn't generally make anyone's life better. I believe, like I said in that tweet of mine, that there are 3 things that genuinely make people happier, healthier, more tolerant of themselves and other people, more resilient, etc., which is sitting with something, learning to just sit with something as opposed to reacting right away. So pausing, delaying, sitting with, however you want to, reframe that. Number 1. Number 2, developing an attitude of acceptance over time about something you feel or think. And number 3, increasing the muscle of tolerance, increasing that metacognition, as it were. Because the more we tolerate things, the more we have what we call self-efficacy. And so I just can't imagine that knowing things is actually that useful. It seems like tolerating, accepting, and sitting with things, which are kind of interdependent skills, is what really allows people to thrive in life. Mathematician says, being okay with negative feelings. Absolutely. Because developing the ability to sit with and tolerate and accept things like you would in ACT, acceptance and commitment therapy, appears to be very helpful across different types of diagnoses like OCD, anxiety disorders, PTSD, depression, substance use issues. So for me, I can't imagine a world where I would emphasize knowing things. Thomas says, don't just do something, sit there in it, right? So one of the things you can importantly do is just sit there. Just sit with it, right? So for me, a lot of the therapists and counselors and coaches and psychiatrists that care all about knowing things. How is this about my childhood? How is this about my mom and my dad? How is this about my ex? How is this about my trauma? All of which is perfectly valid. So I'm not trying to say that thinking about these things and understanding cause and effect is invalid. What I'm saying is, in therapy, knowing things is not usually where people grow or heal or change behavior patterns. For most people, that knowledge piece is like 1 to 10% of the change process, of the healing growth process. It's the doing differently part, which is what the behaviorists got correct 150 years ago, or 100 years ago at least. Like if we choose to act even just a little bit differently, we'll probably have a very different result. Insanity is doing the same thing over and over again and expecting a different result. So I'm all about not being insane in this context. I'm all about doing differently, right? And I've been trained psychodynamically. I grew up in an analytic place. Yeah, Jonathan said, I've heard Patrick say, I don't know shit many times, which is true, Jonathan. I don't know. I mean, this is something that's always fascinating. I've been doing clinical work for a very, very long time. And in my career so far, what I've noticed is people will often ask me to have an opinion about what is going on inside of their mind. And so for me, I just can't imagine rendering an opinion about something that's going on inside of their mind because I don't know everything going on in their mind. What do you think about how I handled that with my ex? What do you think about how I think about myself? So it's like, I don't know. I really don't know what to think because it's your life, right? And I'm not trying to weasel out of it. It's just, I don't think it's my opinion that's going to make you change your behavior. I think it's actually your opinion of your behavior that's going to make you change your behavior. Mathematician says, needing to know is a form of control. Right. We humans struggle with the unknown, 100%. So, no one knows everything for sure. And if they do, they're lying, obviously. So, yeah, you're right, mathematician. I would say it's really important, genuinely, to honor and have patience with the fact that we want to know things because knowing allows us to feel less anxious, right? It gives us more of a sense of certainty. Now, in my opinion, knowing things is a false certainty. But that's just because I kind of have this Buddhist thing about my life. However, when we think of the problem of therapy from the perspective of what am I doing differently, it's not the knowing that's going to prompt you to do differently usually. It is usually having the experience, right? So if you want to be super, super like humanistic existential about it, we feel the most motivated to change or do differently when we feel different. And what's going to cause you to feel differently? Typically, it's not knowing things. Typically, it's sitting with it, accepting it, having a new experience. Thomas Green, says, Edgar Allan Poe, I became insane with long intervals of horrible sanity. Yeah, right? And like, who wants that, you know? Humor's good. I think humor's amazing. So for me, what I would say is it's very, very important to not worry about knowing things. So if you're in therapy, if your loved one is in therapy, if you're doing family therapy, if you're just trying to be supportive of someone who's taking psych meds or whatever it is, I'm not saying just ignore all things and don't think. I'm just saying the emphasis on thinking appears to be not particularly useful. It's not going to get you much bang for your buck. And almost no one I've worked with in my career across different settings, rehabs, private practice, family therapy, couples therapy, executive coaching, it's not the knowing that ever helps someone feel better or feel more motivated or empowered. It's usually recognizing that, wow, I sat with that and nothing bad happened or my life got better, right? It's the tolerating, it's the accepting, it's the sitting with that usually allows people to feel better and live better. So for me, I would say you can certainly have complicated understandings of your childhood, your personality, your culture, trauma. All this stuff is important. And at the same time, as important as that is, knowing anything about those things is different than accepting those things, tolerating those things, sitting with those things, right? Like most people that are built different with their personality don't accept that they're different. And that's part of why they suffer and they're miserable, right? So in therapy, not knowing, unknowing, as the original post said, as Joshua said, I think that's the goal. I think the goal is to be in kind of a flow state. And most flow state research does not involve thinking. It involves doing. It involves accepting and tolerating and working with the energy and letting the energy roll as opposed to trying to force ourselves to think our way into something. Like, I have never in my entire clinical career found someone thinking their way into fulfillment, thinking their way into sobriety, thinking in their way into PTSD recovery. I've just never in my life, hey Phil, good to see you. I've just never in my life seen someone think their way to sanity. I think sanity is not where thinking lives. I think thinking is where insanity lives, usually. So for me, knowing is mostly useless. And then the therapists that care about knowing, the therapists that are like Sherlock Holmes, they want to use their deductive reasoning to help you understand your life story and stuff like that. To me, what that seems like, and there's nothing I have against narrative therapy per se, it's just, it seems like that's for the therapist. I think therapists intellectualize all the time because they cannot tolerate their relationship with you. I think therapists intellectualize all the time because they cannot tolerate feelings with you. They cannot tolerate uncertainty with you. So when therapists get anxious, they tend to rely on easy concepts like knowing, like psychoeducation. I think psychoeducation is almost always this lame anxiety management thing that therapists do. And I say lame, and I mean that in the technical sense of like they feel disempowered, right? And so if you feel disempowered as a therapist, I encourage you not to lean on the brain, you know, because like talking about the brain is mostly bullshit, number one. But number two, like you're just doing magic. You're just trying to convince people. And Willow agrees as she stretches. So for me, what I would say is it's really, really important to not get stuck in knowing or intellectualizing as a therapist. So if you're out there and you're a clinician, a counselor, a coach, whatever, I encourage you to drop the knowing thing and to not care about it and not emphasize it because I don't actually think it's helping people. I think what's helping people is sitting with, tolerating, and accepting. I think those three things, learning how to sit with things or tolerate things, etc., which is kind of the same thing in all fairness, that is where you increase metacognition. That is where you live a better life. And I've never seen thinking be particularly useful. And that's one of the things I hate about so many of these therapy influencers online is because, it's like if you just do your attachment style, you'd be happier. Like, no, that's not true. So many people walk around talking about their diagnosis, their attachment style, and they're still miserable because knowing things doesn't make you want to do things differently, And it doesn't make you more compassionate to other people, by the way. Like, how many people have access to all sorts of AI and knowledge and Google Scholar and research, and they still hate people for their politics, their sexuality, their gender, all sorts of things. And it's absurd, right? And so knowing has made no one happier. Knowing things has made no one saner, in my experience. So I would encourage everyone who's in therapy or counseling or rehab or whatever it is, that if your therapist is so stuck above the neck, then maybe, just maybe, that's about your therapist and not even about you. They can't tolerate you, maybe. Maybe they can't tolerate themselves because a lot of people in the profession cannot tolerate themselves. They're insecure about this, that, and the other. They have their own shame or their own trauma they haven't really had a good relationship with. So because they can't have a good relationship with themselves, they can't have a good relationship with you. Because they're afraid of you, they can't have a good relationship with you, right? So I really hope everyone is hearing the spirit of what I'm trying to say, which is, I'm not trying to give you specific advice. I'm not acting as your clinician or anything. So don't sue me or whatever. I'm just saying my experience, 100% full transparency as a professor, as an executive consultant, as a clinician. In all three realms, I've seen this over and over again. It's not knowing. Knowing has never really pushed someone into better action patterns. It's never made someone feel better. It's never made someone feel more in charge of their life or put them in charge of their life. Knowing has never done those things in my experience. It has always been sitting with something that you don't want to sit with that's helped you feel stronger. Tolerating something you think is literally intolerable, like an exposure therapy for PTSD. Or accepting something that you believe should be unacceptable. Like if you've been betrayed or violated, moral injury, and all that stuff. So tolerating, accepting, and sitting with. Sitting with being a momentary process, tolerating being an ongoing process, and accepting being an ongoing journey. I hope that makes sense to everyone watching and listening because I don't want it to come across like thinking is completely forbidden or terrible or something. I just don't want people to get stuck in the intellectualizing loop, in the narcissistic, I have to know to feel good about myself and feel powerful thing. So please, everyone who's listening, watching, please comment and let me know if that's absurd. Jonathan says, in lieu of suing Patrick, he will accept getting canceled. Absolutely. Dear everyone who watches this podcast or listens to it, please cancel me. I am so looking forward to all that corporate money to do this podcast full time. So whenever you want to cancel me, just pretend I said every slur under the sun. Pretend I flirted with you so you can get me fired. Like whatever it is, just like if you want to cancel me, I'm down. I'm ready for that big payoff. I'm ready for the Daily Wire dollars. I'm ready for the CNN dollars. I'm ready for the Koch brothers. Whoever wants to pay my bills, like you want to cancel me, I'm ready for the speaker circuit. I'm down. I'm 100% ready at all times. Let's get me canceled. Pretend I said every nasty thing about the group of people you think is the most victim, and I will take the money and run. Math Magician says, humans are more than personality profile, sexuality, trauma, and upbringing. Absolutely. 100% they are. They're more complicated than those things. This is why we fall back on saying, she says, what humans become is based on both nature and nurture. Right. It's both nature and nurture. It's much more nuanced, like I discussed. Yeah. Math Magician says, you're making such a difference in the world. No need to be canceled. No, cancel me. Please cancel me. I'm so excited about all the corporate sponsorships and being on the board of this, that, and the other business I have no business being on the board of, and just like, let's make me a full-time podcaster so I can get canceled. So please, everyone watching, listening, just imagine I said the nastiest slur that I could have said so that I can get those corporate dollars and become just a talking head for the rest of my life, because I don't know. My life is too good and too comfortable right now. I feel like I should screw it up or something. So let's get me canceled, please, please, please. All right. So, knowing versus doing. I'm of the school of thought of the brand Nike. Just do it. Just sit with it. Just tolerate. Just accept. That's where I'm at. Okie dokie. All right, let's move on to the next topic here so we can, move on and have some fun here. Thomas says, I learned from my therapist emeritus that he was provocative in his comments to me on purpose for a reason, to challenge my thought process. Right. It served me once I got over initially being offended. Yeah, absolutely. Sometimes challenging people is very useful, for sure. Yes, that's right, Jonathan. Daily Wire cash. Let's go. Let's go. Let's get that provocative Daily Wire cash or whatever. Who knows? All right. Let's talk about a person I don't speak about too much on this podcast, but I think this could be useful. So, Dr. Nicole LaPera, and I believe her handle is @TheHolisticPsych. She said this back on February 25th, so it's been a minute, but I think it's worth talking about. So let me just repost it real quick, and then we'll move on. Okay. So here's what she said on February 25th. What she said was, no one changes because you beg them to, or because you give them an ultimatum. And if they do, it won't last long. The only reason people actually change is because they're so sick of dealing with the fallout of their own behavior. They have no choice. So she says a couple of things I like and one that I really don't like, and so we'll talk about this. Because behavior change is complicated. Some of it's very simple, and some of it's more complicated. So, let's start with the things that I like about what she said. She said, first and foremost, no one changes because you beg them to, or because you give them an ultimatum. Okay, so those two thoughts, begging and demanding, giving them ultimatum. No one changes because you beg them or you demand that they do. Fair enough? And if they do, she says, it won't last long, which she's 100% correct about. We have all sorts of research, motivational interviewing, other things, that shows giving people artificial demands that don't matter to them, does not cause long-term behavior change. And if you don't believe me, go check out Rehabistan, where I live. Rehabistan is full of people who are coerced there by the legal system, their families, their friends, their bosses, and they don't get better. And the reason they don't get better, well, there's many reasons they don't get better. But the real reason, if we're going to umbrella, talk about this very meta, is because that's what we call extrinsic motivation. So extrinsic motivation is anything outside of yourself. Money, status, prestige, family, friends, job. All these things are extrinsic, external. So extrinsic motivation, we've known for a very long time, philosophers have known forever, but in behavioral psychology research, we have learned forever, since the time of the behaviorists 100 years ago, that extrinsic motivation is a short term. I'm going to say this again. Extrinsic, external motivators are short-term change agents. So these catalysts for change only work short-term. So there's nothing wrong with extrinsic motivation. The problem is it doesn't last, and it will never last. We're just not built for that. So if your loved one is in therapy, if your loved one is in Rehabistan, in a rehab somewhere, in a clinic somewhere, in an IOP, whatever it is, you have to be patient with them, because if they're only there because of external pressure, their job is actually to find internal motivation. So intrinsic, internal, extrinsic, external. So intrinsic motivation, feelings, values, beliefs, right? Feelings, values, and beliefs. These are common intrinsic motivations. So these intrinsic motivations tend to correlate to much longer lasting behavior change. So this is where I disagree with Dr. LaPera. She said the only reason people actually change is because they're so sick of dealing with the fallout of their own behavior. And I disagree with this because it's not true. It's just not even in my clinical work not true. It's just, according to the research, not true. Excuse me. Like, people can have a bottom when it comes to drug use or whatever, but they're miserable for 5 minutes, for a week while they're in detox or in their hospital. But sometimes even while they're in detox or in the hospital, the misery goes away a little bit and they go get high again. So depending upon the type of fallout they're experiencing, it may or may not actually serve as an intrinsic motivator. It might be mostly extrinsic. So the other important thing to consider here, Dr. LaPera, if you look at the motivational interviewing research and the trans-theoretical model research, it's very, very clear that people need a variety of motivations. They need a number of factors to come together at the same time for them to produce long-lasting change. Because a lot of people are fed up with being overweight. A lot of people are fed up with feeling tired with regard to insomnia. Like, you could pick any clinical problem, diabetes, obesity, insomnia, PTSD, addiction, mild substance use, whatever it is. You can pick any problem behavior that clinicians can address. And it's not like there's going to be one value or one feeling or one person that is the catalyst for long-term change. Because we are complicated creatures, it's actually the case that we need lots of different sources of ongoing intrinsic motivation to stay changed. Extrinsic motivation might get you in the door, right? So like, your parents kicking you out of the house might get you into rehab. Your spouse kicking you out of the house might get you into rehab or AA or something. However, what's going to keep you in AA? What's going to keep you in treatment? What's going to keep you in trauma therapy? Is it the extrinsic motivation of your therapist or counselor? Is it your sponsor in recovery? Sometimes that helps, but it's not just that. It's also what happens inside of you that matters a great deal. So if you're currently in therapy, if you're currently in treatment, I want you to hear me loud and clear that because you are complicated, if you really want to respect yourself, you have to understand all the layers to yourself, including your personality, your culture, all these things, and also your values, right? I think for a lot of people, this is not a super sexy conversation, but to me, it's an extremely important conversation. So your values matter a great deal, and if you do not live in alignment with them, you will be miserable. That's a spiritual truth, that's a religious truth, that's acceptance and commitment therapy, that's all these things. And so what I would say to everyone who's struggling to make headway in their recovery, in therapy, and all these things is, I hope that you understand how complicated you are, and I hope you're questioning, what are my values? And how does my behavior align with my values? So if I really, I'll just use myself as an example. My top 3 values as a person are grace, humor, and integrity. So grace means giving myself and others a break when it's appropriate based upon the circumstances. Because, we should have reasonable circumstances and reasonable boundaries and barriers, right? Reasonable judgments. Secondarily, humor. We should try to have fun. We should find the humor in things because it keeps everybody sane. And number 3, integrity. If you say you're going to do something, please do it. If you need to renegotiate something you said you would do it honestly and forthrightly. Don't make up an excuse. Don't lie. Just do what you say you can do and say what you can't do. And it's that simple, right? So if I choose to live in alignment with those values, I sleep great. I make better decisions about food, about drugs, about sex, about all these things. When I choose not to, when I ignore my values like humor or grace, I have more conflict with my partner. I have more conflict with my colleagues, right? So it's about creating a life based on values. And that is much harder to do in early recovery from drugs, trauma, personality disorders, whatever it is, because it doesn't seem super important. What seems super important to most people, like I said earlier, is just feeling better. I don't want to be miserable anymore. And fair enough. However, not being miserable is not the same thing as being healthier or being okay. So for me, I don't think, Dr. LaPera, that the only reason people actually change is because they're so sick of dealing with the fallout of their behavior. I think that's too simple. I think the other reason people actually change is they realize how out of alignment their behavior is with their values. They realize which values matter. Maybe they grew up with some values they don't actually agree with, and so they go to therapy or treatment or whatever, and they realize what their actual values are. So, just be careful of this influencer kind of talk that she uses. She's not evil or something. I just think she misses the point sometimes. All right. Okay. So I have one more that I think is worth discussing. Let me see if I can find it here really quick. Okay. All right. Dr. James Davies is actually going to be my last post for this conversation. So I'm going to come back to him, but it's a much older post because it fits the theme of today. Okay. So this is a post where I actually agree with him more. So back on November 8th of last year, 11/8/2025, at J. Davies, PhD, said this. He said, the widespread and worryingly uncritical use of the word treatment to characterize almost any mental health intervention is symbolic of how so thoroughly our medicalized ideology has permeated and ultimately disfigured how we understand the meaning and purpose of emotional pain. Excuse me. So, I think there's all sorts of good stuff in here. That's a lot of big words to describe a very simple problem. So this is going to be my summary of what he said. So he's saying there's this big push to describe a bunch of things as treatment that really aren't even fully treatment. And the big problem here that he's alluding to is a lot of pain, distress in life is considered an illness when it's actually not. That's problem number one he's pointing to. Number two, the things that are illnesses are probably treated with things that don't even need those treatments, right? So I'm sure he would say in reference to like medications. Many things in life are medicated that do not need medications, in his view and many people's view online like him. So let's just talk about two easy examples in mental health. So anxiety, okay, big umbrella category, anxiety, often needs zero medications. In fact, there's no quality research in clinical psych that actually says mild to moderate anxiety actually gets better with medications long term. So, number one. Number two, personality disorders, right? So people with BPD, people with narcissistic personality, people with antisocial. There's basically no way to medicate away the symptoms or the impairment from these issues. So going back to anxiety, the distress, the pain of having excessive anxiety about a situation, right? Like I just got fired, which I keep praying for, or I just got broken up with. Like All of these things produce an ordinary reaction, I would think, in most people, which is anxiety, worry. What's going to happen? What do I do? I've been fired. What do I do now? All these things are perfectly ordinary, and it makes kind of literally no sense logically, clinically, to medicate them. Here's some Lexapro because you're anxious that you just got fired. No, that anxiety is actually perfectly adaptive, because the anxiety will push you to do something to rectify the situation, to get a new job, to make money, whatever, to sue your employer. I don't know. So, like, the anxiety is useful. So, why would you medicate it? It's not an actual illness. Also, that's not treatment. That's numbing, and numbing is not treatment. So, anyways, that example. But pain, let's talk about pain. Life is pain. To quote Dr. Gregory House, MD. And I know it's a TV show and he's a fake person, but he's correct. If you're alive, if you're really paying attention, then you should be experiencing some kind of pain, at least from time to time. I'm not saying I hope that you're depressed or something like that. What I'm saying is there are plenty of normal challenges, to use a fancy word, the vicissitudes of life, etc. Like the normal challenges that people face, challenges related to, existential uncertainty. Where is my life going? Relationships and love, health, illness, things like that. Like, I love this little cat behind me. She's great. And she's going to die someday. And she's going to get sick maybe or get hurt. And that will be crushing to me because I love this cat. This cat's a big part of my life. I love Willow. That being said, that is normal pain. Grief is normal pain. Heartbreak is normal pain. Loss is normal pain. You lose your job, you lose a piece of your identity, you lose your leg, etc. This is normal pain. And there's this really weird, kind of like narcissistic or almost pathetic impulse by many providers, therapists, psychiatrists, general practitioners who dispense the most medications, to numb people away from the ordinary distress of their life, right? So, like, just to give an example that's current events related, many people right now in this very moment are in all sorts of pain over whatever's happening politically in the United States, in Iran, in Ukraine, and all these things. One of my patients is from Russia and is in terrible pain because of the consequences of the war. And it makes no sense to me to medicate that pain, that psychological pain. And every time she cries, it's so weird that she wants it to go away, to me. Not that I want her to be miserable, for instance, but it makes perfect sense to cry because the people you love are dying and being maimed because of a war that they shouldn't even be participating in, per her report. So for me, I don't have an opinion about it, but for her, it's like this is a senseless war and she feels miserable. She's grieving. She's angry. She's hurt. Why would you medicate that? That seems like a perfectly ordinary and reasonable reaction to a tragedy. And so I agree with you, Dr. Davies, that this desire to treat things that aren't actually illnesses is a huge problem in psychiatry and in psychology. And if you're a therapist out there, a counselor or a coach, I encourage you not to satiate someone's pain, to make them feel better when they have ordinary misery. Because life is pain. Part of life, if you're a Buddhist, right? Suffering is the clinging to when we should not cling to. Attachment to. And so it's really absurd how many clinicians out there have their own unexamined issues with pain, sadness, hurt, grief, longingness, that causes them to attach, that causes them to try to treat things that do not need to be treated. So, Dr. Davies, I really appreciate you posting this because it brings to mind many problems. And this is why clinical training and supervision is so important, by the way, because whatever our unresolved stuff is as professionals will force us, will come out sideways, will seep out into our clinical work. And if we're not aware of it, it can really hurt patients. It can cause us to treat patients based upon our stuff, our pain, our hurt, whatever it is, and that is not ethical. You know, it's like talking about these contentious things like politics and war and all this stuff. It's like there's a very human element, but there's the you piece of it. And if you're in the role of authority, of the role of therapist, or the role of counselor or coach, if you are not aware of your stuff, boy, is that not okay. Because you're going to bleed on people. And it is not our job as professionals to bleed on people when they're the ones who are struggling and seeking help. It's our job to be fully aware of, to the extent that we can humanly, our stuff so that we do not bleed on people, so that we have a healthy human relationship with people where we can role model being aware, being of integrity, doing what we can to take care of people in a way that they say they need and not project our stuff onto them. So if you're out there and if you're in therapy, in counseling or coaching, and politics is a topic or whatever it is, you should have boundaries with your therapist, and your therapist should be having boundaries with you about that. You know, we should be human, but we should not let our own personal pain, torment, shame, judgment, whatever, drive what we do with people. And many things should never be treated. Many things that are considered treatments aren't even treatments, right? Like gratitude. I love gratitude. I think gratitude is awesome. I try to tweet about it a couple of times a week to remind myself and other people that it's good for me, at least. But like, gratitude is not an intervention that actually manages psychological pain effectively. It's useless, basically. There's like a couple of good existential humanistic psych reviews that say it's useful, but like, gratitude is not a treatment. It's an attitude that's useful, but it's not a treatment, right? It's pseudo-spirituality to think of it as a treatment. A bunch of things like ketamine. Boy, we are going to go down a terrible road with ketamine. And I think it's going to end up being a great sin. We're going to realize how bad it was to actually put ketamine everywhere all at once to try to help people with ordinary depression. So, those are just my thoughts. So thank you, Dr. Davies. But there's some comments here I want to catch up to. My buddy Jonathan says, anxiety is just a wave, my dude. You can get slapped in the face, you can surf it, or you can get out of the water. Sometimes we gotta surf. Sometimes we gotta get out of the water. It's not super fun to be slapped in the face, that's for sure. Mathematician says, you are a man wise and intelligent beyond your years. I am neither wise nor intelligent. I have moments of intelligence, and the wisdom I have is mostly garnered from the people around me. In fact, to be fully sincere and transparent, many of the people that come watch these live streams and chat with me on Twitter are a great source of wisdom that I just get to absorb. So I'm very grateful that I get to regurgitate things that just make sense to me, you know, to be quite fully transparent about it. But thank you for the compliment nonetheless. Thomas says, the pharmaceutical industry is so ingrained in our society. Yes, it is. And people are so dependent on immediate gratification and relief from emotional pain that the first approach to everything is to medicate. Absolutely, I agree. And the more we self-medicate our momentary distress, our momentary pain, and our existential pain, typically the worse it goes. That being said, we all have our breaking points. And I don't want anyone to be miserable forever, so I understand if you choose to medicate. It's really hard, I think, to find the right balance of tolerating pain, accepting pain, sitting with it, and, you know, finding relief. And we all need relief. It's a question of how much relief we really need and can tolerate in any given moment. And that's a very individual thing. That being said, boy, we don't need there's just so much Lexapro out there. There's so much There's so many antidepressants and psych meds. It's very discouraging how often that's the case. And I'm not saying that those things aren't useful. I have a couple of patients right now who are on them, and they are miracle drugs for those people. And I'm grateful they're on them. I just think that as a general rule, we try to medicate away our pain, our ordinary distress, our attachment to, our clinging to in the Buddhist sense. And we need to get a better relationship with that over time. Sometimes therapy helps. Sometimes religion helps. Sometimes friends help. Sometimes pets help. There's lots of things we can do to have a better relationship with ordinary distress and suffering. And for me, the solution is aloha, non-attachment. So anyways, thank you all for being here today. And thank you all for commenting and chatting. It's so awesome to have all of you here. Some new faces, some old faces. Very, very glad you're here. I hope that if anything you heard today was helpful, useful, interesting, that you like, share, and subscribe. Help me build this out so I can get canceled and I can get that sweet, sweet internet money from being a talking head. No, I'm sort of kidding, sort of not kidding. But please help. Let's get the word out so we can share more ideas that are useful to people in therapy and treatment, family members who don't know what good treatment is. So thank you all for being here. I will catch you all next week at the same terrible time with the same Celsius and all this stuff. And this week there's no joke because I couldn't think of anything funny this week. I'll see you next week at the same time. So I hope you take very good care of yourselves. You eat some good food, you get some good rest, you have some good sex, you have some good fun, you have some good laughs, and I hope that all goes